What about the choice of patients? Is choice being taken away from everyone and just being left in the hands of certain bureaucrats who are taking this decision?
See, this question has been discussed so many times. I had been in Central Health Services for almost 30, 40 years, and also in Medical Council of India for 5 years, and then National Medical Commission now. I'll share with you that this is all the effort is very good, intent is very good, and it is in the interest of the public. But are we getting the benefit translated to public? Is it only doctor who will be prescribing, and then the rest of the things? Three things we are missing. That you doctor prescribe everywhere. The patient is not that literate or that approachable that he will be going to Jan Aushadhi or Amrut or Ayushman centers. But that when the patient goes in rural India, which is majority, or any other places, they will go to a chemist, and chemist will give whatever he wants to give. So I'm not talking about the big pharmacy which Anmol was mentioning, but I'm talking about that what quality the patient is ultimately getting. The patient is not getting the right quality mostly. He may be getting good quality in Janoshid or Amrut if he reaches. There are 3,000 medicines, and we are talking about 600-700 medicines. What about which are very, very costly medicines, life-saving medicines, which when the patient reaches the chemist, he will go whatever he wants to give. I'll tell you that we have taken up in IMA level also, Indian Medical Association and Delhi Medical Association, where also I am representing. I'm in Drug Controller General Office, also as a member in CDSCO and FDA. The problem is how many the brands which a chemist is giving, are they PK studies done? They are tested, or the samples like food samples are picked up? Are the samples picked up? We are living when the brand is there, then we have some surety that what is the quality. These studies have been done many times, but yes, when the approvals are given, the prices are to be regulated at that level. What I believe, I have always said that prices are to be controlled at that level, and by opting for the easier route, that doctor cannot write, that doctor will write generic, and then chemist can give anything.
Is everything that is generic necessarily of poor quality, or is this just a misnomer?
No, not at all. Everything that's generic is not poor quality, and the fact is that, see, drugs are typically measured on two counts. One is safety and second is efficacy. And that is the standard most of the drug applications have to pass with every global regulator. India ought to be no different. So if there is a generic substitute available, then it ought to be of the same quality. Otherwise, you don't prescribe the generic. That's the rule for societies where generic penetration is significantly higher than in India. So I think the laws, the protocols for this are fairly well established globally. You just have to copy them and not apply yourself. What is, however, what is very different in the Indian context is, and I think there's not a lot of attention which is paid to that, is that what is the median insurance penetration? Because see, at the end of the day, this is a fairly institutional dialogue between the payer and the producer. And while India doesn't have universal health care, there is a part of the market which is being addressed, but the conversation essentially ought to be institutional between the payer and the consumer. The consumer ought to be represented by the insurance companies. Now, sadly, where we are in our terms of insurance penetration, I think OTC drugs are not covered by insurance. I think that's an idea which would make a lot more sense at this point in time. Even the government insurance, I think that is something which needs to develop guidelines. there is a need to put a lot of flesh around the bare bones of this desire to provide quality healthcare, because at the end of the day, someone has to pay for it.
So if there is so much detailing that has gone into even that kind of a template for a prescription, why are these other issues that Dr. Sood and Anmol have raised here, why do you think they are being missed, Dr. Bhardwaj? Because this knowledge is available and this debate has been going on for decades now.
I feel that it's going to be just another law which will definitely need a lot of change. The intent is very good. When you showed the figure, intent is excellent of figure costing, but it is not being thought through. The chemists and most importantly the manufacturers, the ban before being on doctors should have been on manufacturers for producing branded drugs. They should immediately stop this very minute. Na rahegi baas, na bajegi bansuri. Why blame the doctors all the time? We cannot have a set template of prescription. In fact, in private practice, let me tell you, I was trained abroad in Germany. Senior doctors wrote the diagnosis of the disease differently than what everybody else did. I'm talking about the world's topmost doctors, only so that the patient cannot take a second opinion also and doesn't really understand. The doctors made their own diagnosis. I think it is a kala, it is a skill which is very, very old and ancient in India. We are very, very famous in our medicine, and we should not downgrade our doctors.
If you like the video, do like, comment, share and subscribe.